for Hodgkin's lymphoma. I was using ABVD, which is 4 different drugs: adriamycin, bleomycin, dacarbazine, and vinblast. I think I got all those right. Today my treatment will actually omit the bleomycin because I feel like I'm getting some lung complications from it, and I'm at peak treatment. Today might possibly be my last treatment, so I wanted to do this video. The purpose of this video is to give people who are getting ready to start the process an opportunity to see what happens, to understand what all the different terminologies mean. If you get on websites or you talk to nurses, they use language that doesn't really make a whole lot of sense. They use words like push and port and PICC line and all kinds of things like that, unless you see it or you are told this by someone who has chemo already, you may not understand. So that's the purpose of this, and also for any of my friends or family, especially my mom, who wish they could be here with me or just see the process a little bit more. We're getting ready to go into the infusion center, and in the infusion center, what happens is I will first get my blood drawn out of my port. They'll access my port, they'll draw my blood, and then they'll access and look at it and see if I am okay to do the treatment. I have been typically fine to do treatment, and then I wait, and then they start treatments. And I want to try to get a video of all of that for you so that you can see what this is all about. Again, bleomycin won't be included, but basically most of the stuff will be the same. I do omit also the steroid and Ativan, which are 2 other things called a push, which I'll explain later, that they typically will give you before they start your cocktail. Now I'm in the area where they take your blood prior to finding out if you can do your chemotherapy for the day. And then you would also come in for this, if you're doing ABVD, the middle weeks too. And this is my port. So this is a little piece of plastic essentially, and it has a line called a catheter that goes into a vein that goes toward my heart. This is the scar from it, so the doctor did an awesome job. This is what they're going to access. Some people will put lidocaine on it beforehand so that they don't feel any pain when they access the port, but it's really not that bad when they access it. I don't really feel a whole lot, just a little bit of pressure. The hard part is when they inject the heparin to keep the line clear. The taste of that and the smell of that is really hard and gets harder for me every time. The same thing with saline. So on my middle weeks, when I come in and I'm not getting chemotherapy, I just get this done in a vein while my veins are still good. I can do that. So, and then you don't have to deal with the heparin or saline or anything like that.
Shouldn't ever be more than 2.
I just had my port accessed by the nurse, and she took a couple vials for blood to see what my blood levels are, and then she's cleared it back out with heparin and saline, which tastes pretty disgusting. And then this is what it looks like accessed. Now she's going to cover it. This is where I have my treatment. I got a pod today, which means I have my own little separate room. That's really nice. That's where they hang the bags for the IVs. So the bags hanging are the IVs, and then they have syringes which they use, and that's called the push. And I get both. You won't get to see them administered, but try to give you the best idea. This is the Amend pill. It's supposed to be for nausea. I've gotten really good about not even needing to take the last one. It's kind of a challenge that I give myself. However, I get nauseous kind of before I even come now, and I actually just got sick, and all they put in was an anti-nausea drug. So it's just the taste of the drugs going through that kind of made me sick. That didn't really start until like 3 treatments ago. So I'm getting ready to take my Amend. Hopefully it stays in my tummy, and that's all for now. And then she already gave me the push, which you just saw. The syringes are the Aloxi and Chemobrain. One other thing I'll remember later and tell you. These are adriamycin, And they also call this a push. The small bag on the right is Vinblasting. It takes about 10 minutes. And the large bag on the left is Decarbazine, and it takes an hour. And the one in the middle is just saline that they flush through. So now I'm getting the final drip, which was the Decarbazine that I showed you here. And this is how it comes in. All of them that are drips come in this way, and they attach into your port here or here. This is where they inject the pushes. So there's a couple different places that they can go in. And after this one, I will be finished, maybe finished for good. I do have a Neulasta shot to take after this. Neulasta is something they give you to help build your white blood cells back up, and that is because the chemotherapy will break down your white blood cells. Kind of works against the good cells and the bad cells. So that'll help boost my white blood cells back up to keep my immunity up. And then once a month I also get a Lupron shot, which is something that they say tends to help protect your ovaries. It kind of puts you in menopause, hides your ovaries from the chemotherapy, again because it likes to go and attack actively dividing cells. I don't have to do the Lupron today because I did it on my last treatment. And I'll do it one more time. If this is my last treatment, I'll still need to do that one more time. So signing off for now. I hope that this has been super helpful for anyone that needs this, and hopefully in the future I can, if this seems to be useful for people, I can maybe give a little more information.